Hello and welcome to the session. My name is Anne Bryce. I'm Head of Knowledge Management for Public Health England and also the convener of the Evidence for Global and Disaster Health Special Interest Group. Never before has everyone been so aware of the need for reliable healthcare information and yet so vulnerable to misinformation, an infodemic, a growing and continuing threat to global health. COVID-19 has presented many challenges for librarians, but also some opportunities. For instance, being able to provide access to reliable healthcare information, ensuring that their communities can tell the difference between what is reliable and what isn't. But is providing information enough? What are the shifts that need to happen to secure the political, financial, and professional commitments needed to ensure good quality health information for all? To make this happen, do library and information professionals need to take a lead? And if so, how and who with? The speakers at this provocation session will present views and options from 4 different perspectives. This will be followed by a question and answer session, which we hope you will join us to debate the issues and solutions further, but also to challenge ourselves, the profession and others, to take the actions needed to enable change. Our first presenter, Neil Pakenham-Walsh from the UK, will start by considering the role of the state in ensuring that citizens have access to reliable health information. Thank you, Neil.
Thank you, Anne, and hello everybody. My name is Neil Pakenham-Walsh and I'm a member of the Evidence for Global and Disaster Health Special Interest Group. I'm also the coordinator of a project called HIFA, Healthcare Information for All. HIFA is a global social movement working for a world where every person has access to reliable healthcare information that they may need to protect their health and the health of others. And I'm delighted to be presenting today with my colleagues, Margaret, Ola, and Blessing. Today, we'd like to address the 2 most important challenges facing the health, library, and information profession. The first is this: people are dying because they do not have access to reliable healthcare information. Sometimes a personal experience can be life-changing. For me, more than 30 years ago, I was working as a volunteer medical officer for an archaeology project in Peru. One day, a Quechua woman came to my health post, distressed, with a bundle in her arms. I unwrapped the bundle to find a little girl, dead. It turned out the girl had been ill with diarrhea for the past few days. So the parents stopped giving her fluids, believing this would help the diarrhea. She got worse and worse, more and more dehydrated, until finally that morning she was barely conscious. At that point, the mother finally decided to bring her to the health post, a 2-hour walk from their home high up in the valley. But she died on the way. Today, 30 years later, more than 1,000 children are still dying around the world every day as a result of failure to give the correct basic treatment for child diarrhea. And this isn't a problem just about diarrhea, it's about all diseases. And it's not just a problem of information for the general public, it's health workers as well. Research by HIFA has shown that many health workers lack access to basic healthcare information. And as a result, there is enormous and needless suffering and loss of life. Modern medicine is failing much of the world's population, even at a basic level. It's estimated that between 5 and 8 million people die needlessly due to poor quality care each year mostly in sub-Saharan Africa and South Asia. Many of these deaths are due to a failure to access and apply reliable healthcare information. Let's look at the second challenge. As Anne mentioned in the introduction, misinformation. Again, people are dying due to misinformation. And it's clear that the problem of misinformation is getting worse. This is because of widespread internet connectivity and social media, so that now all of us are deluged with misinformation. As Dr. Tedros, Director General of WHO, has said, misinformation spreads faster than COVID itself and is just as dangerous. WHO has created a special unit to disseminate and amplify evidence-based information about COVID-19, and it tracks and responds to misinformation, myths, and rumors. Misinformation is often portrayed as something new, but it isn't. People have been dying due to misinformation for thousands of years. Take the example of trepanation. Archaeologists have found that we've been drilling holes in people's heads in the false belief that it will let out evil spirits for at least 6,000 years. And there are even people alive today who advocate this dangerous treatment. So the whole of human history has been riddled with misinformation. We're in not so much an infodemic as a chronic endemic. And it is only in the past 200 years that modern medicine has started to bring us information that we can rely on. What's changed recently is that misinformation spreads more quickly thanks to technology. And most initiatives are trying to fix this with technology solutions. But these initiatives ignore the fact that misinformation is a symptom, not a disease. The fundamental cause is a dysfunctional global healthcare information system. This was described back in 2004 when the World Health Organization invited Fiona Godley, who is now editor of the BMJ, to lead a team of people, including myself, to look into the question of how to improve the availability of reliable healthcare information. We concluded that the global healthcare information system isn't working and that there was a need for a new initiative to promote better communication among all stakeholders working in the system: researchers, publishers, librarians, information professionals. HIFA was the direct result of that report. In conclusion, access to reliable healthcare information and misinformation are just two sides of the same coin. The woman in Peru didn't have access to reliable health information. Instead, she had misinformation that proved deadly. The bottom line is we cannot tackle misinformation unless we also improve the availability and use of reliable information. So what's needed? Well, this is a complex global health issue that is as important as antimicrobial resistance and climate change, and yet is almost completely neglected. Where is the global action plan to improve access to reliable healthcare information and to protect people from misinformation? It just isn't there. We believe there is an urgent need for high-level commitments to address these issues. Library and information professionals should be leading the effort because we have a unique focus on what matters, meeting people's information needs. We know that this is critical for personal health, for public health, and for global health. The medical profession is already on board with us. The World Medical Association represents more than 10 million doctors worldwide, and they recently issued a policy statement on how to accelerate progress towards universal access to reliable healthcare information. This can serve as a starting point. By contrast, governments are often far behind, and we need to bring them on board as well. HIFA published a paper with the New York Law School that shows that governments have a legal obligation under international human rights law to ensure that people have access to reliable healthcare information. The reality is that governments are often ignoring this obligation. For me, one of the most outrageous aspects of the COVID-19 pandemic has been that several heads of state have actively ignored public health advice and have actually spread dangerous misinformation on COVID-19. We don't have all the answers. The important point is that we need to bring the leading players together to start a global conversation.
Thank you, Neil. Thank you very much. Our next presenter is Margaret Zimmerman from the United States. Margaret will be considering the area of health information access as a human right. Thank you, Margaret.
Thank you. My name is Margaret Zimmerman, and I am an assistant professor with Florida State University. Librarians have long been at the forefront of information literacy promotion and the fight against the propagation of misinformation. Never before the COVID-19 pandemic has the health cost of such issues been so transparent. Over the last year and a half, leaders of privileged institutions have weaponized misleading or false health information to benefit their own self-interests. This behavior, along with mirrored responses by their constituencies, has quickly habituated into a pervasive societal mistrust that spans across the globe and has had dire consequences to the public. The general reluctance of some world leaders, such as the presidents of the United States, Brazil, India, Belarus, and Mexico, to adequately embrace practical public health measures has incited groups within their countries and caused mass dissent in people responding to the epidemic. Now, I bring this up not to criticize, but instead to highlight the significance of public health messaging and the receipt of correct health information to the public. In contrast, with the handling of the pandemic by some nations, other countries such as New Zealand, South Korea, Singapore, Australia, and Finland have had extraordinary comparative success by issuing firm and accurate messaging about the severity of the pandemic and then implementing decisive public health protocol quickly and effectively. And what is the difference of a citizen of India versus New Zealand, except for where they happen to have been born and the opportunities that such luck has afforded them? The United Nations Universal Declaration of Human Rights asserts that all human beings are born free and equal in dignity and in rights. If this is true, then why should a person's citizenry and the whims of their government officials determine the health information that they are given and potentially the health outcomes that they experience in a time of crisis? I argue that it should not, and that access to quality health information is implicit in the Declaration of Human Rights. Specifically, access to health information is guaranteed by the application of 3 articles of the Declaration. By Article 19, which asserts the right of people to receive and impart information without interference. By Article 25, which guarantees the right to a standard of living to maintain health. And by Article 27, which promises the right to share in the benefits of scientific advancement. Simply put, it has been agreed upon by the United Nations that all people have the right to information that has not been deliberately altered or corrupted, that all have the right to as healthy of a life as they are capable of having without their well-being being unduly undermined by their leaders, and that they have the right to benefit from advances in science, which includes advancement in the areas of infectious disease control, including testing, vaccination, and just learning about the efficacy of simple life-saving measures, such as mask wearing and social distancing. So by agreeing that these are basic human rights, a counter-argument can be made that it is a violation of human rights to knowingly promote health strategies that do not work or cause harm. It is a violation of human rights to deliberately obfuscate the public health recommendations of experts, especially in times of crisis when the population is the most vulnerable. And it is a human rights violation to impede the scientific community from promoting validated, evidence-based, credible research knowledge that may save lives and prevent infections, particularly while favoring false cures and pseudoscience. I argue that by a close reading of the Declaration of Human Rights, it is clear that all human beings have a right to accurate, credible health information, and that to conceal or obscure such information is a direct abuse of these rights. Most nations don't place the responsibility of upholding human rights on individual citizens, nor should they. It's not a reasonable burden. Instead, this burden should fall to our leaders, both in governments and community organizations. However, unfortunately, in the past 18 months, it's become very clear that some of those in positions of privilege who have the power to act in the best interests of the many choose not to, and instead decided to issue proclamations that are not in agreement with public health mandates and that do not correlate with advancements in science and medicine. So what are we to do about this? As private citizens, we have very little power to change the actions of our leaders. As a collective, our power increases exponentially. Today, I encourage each of you to advocate as individuals within your own countries for the right to accurate, credible health information in any way possible. As a collective, I challenge you to implore IFLA to respond to this call. Within the strategy of this organization, the first direction states that we will show the power of libraries in achieving the strategic development goals. They go on to describe information professionals advocating for human rights, and empowering librarians to become a united front in responding to current challenges. Finally, IFLA has declared that it has the goal of broadening our membership while increasing our visibility and reach. I challenge you to try to come up with a more significant, timely, and effective call for action for IFLA than to work to secure quality health information as a human right and to leverage our collective position of privilege to advocate for this in every possible way. However, you might be wondering, in a practical way, how can this work be done on an individual or a singular institutional level? Basically, how can a librarian make a difference? As an information professional, the day-to-day labor of our actual jobs is not typically political advocacy, though I would argue that librarianship is intrinsically a radical field. But there is a way that we can go to work every day and take action. This approach is twofold. First, in times of peace, librarians must make it a priority to build individual and community health literacy. Textual and information literacies have long been considered within the purview of librarianship. I would argue that adding health literacy under this umbrella is absolutely within the bounds of community advocacy work, especially as so much of health literacy is truly information literacy within a medical context. Many of us have been long successfully advocating for health literacy to be promoted within the library. However, it's not enough to promote these skills to willing individuals conveniently located within the walls of a building. The pandemic demonstrated that health literacy is both an individual and a community issue, and it must be addressed as such. Some world leaders are willing to compromise individuals health for the benefit of inciting fear, creating polarization, and maintaining their power over their citizenry. Teaching those citizens adequate health literacy is a way of weaponizing the populace against what I personally believe can only be considered a health information war. This can be accomplished by dedicated health literacy advocacy that starts in the library and reaches out deeply into the community around our buildings. Second, information professionals must combat misinformation in times of crisis. If there is a new normal, it will likely be characterized by repeated upheaval brought on by issues such as climate change, wars, and disaster. In such time, it is the role of the information professional to combat misinformation with vigilance, using the skill set that is foundational to our profession. It is our responsibility to reach into our communities and promote credible, accurate health information that is fundamental to positive health outcomes. And it is imperative that we do everything within our power to discredit inaccurate propaganda in favor of credible, evidence-based health information. After all, this is exactly the information that each individual that we serve has a basic human right to obtain. Thank you very much.
Thank you very much, Margaret, for that very stimulating and challenging presentation. Our third presenter is Ola El-Zain. Ola is from the Lebanon, and Ola is going to consider the need we have to build resource centers for credible information. Ola.
Thank you, Anne. Hello, everyone. My name is Ola El-Zain from Lebanon. I'm a member of Evidence for Global and Disaster Health Special Interest Group at IFLA. I have a PhD in biology, and I'm currently the director of the medical library at the American University of Beirut, and also a member of HIFA. I will talk about how librarians and information specialists are an integral pillar in implementing access to information as a human right, and what I try to do to help in empowering people with reliable information. We all have a social responsibility towards ourselves, our families, friends, countries, and the whole world. In particular, there is an urgent need to empower people to tell the difference between reliable information and misinformation. No one can do this and help people better than librarians and information specialists. We cannot ignore that during the COVID-19 pandemic, we witnessed a downside of information. We had an abundance of information. Some information was false and potentially harmful. Inaccurate information, unfortunately, spreads widely and quickly, especially through online platforms. People don't know to differentiate between what's reliable and what's non-reliable. This is triggering fear and anxiety, especially when unmanaged. So we need to provide the right information at the right time in the most accessible format. How can librarians help? Needless to mention that health is a fundamental human right, and this right to health has a number of essential elements: availability, accessibility, acceptability, quality, participation, and accountability. So in fact, librarians can work on acquiring, organizing, maintaining, and/or providing library materials and services that can help people, especially in times of crisis. Librarians can provide this high-quality, reliable information, and on top of that, can also offer education and training so people can differentiate between misinformation, disinformation, and reliable information, especially when it comes to health and wellness and illnesses and disorders. Librarians all over the world are aware of their profession's ethical implications. These emphasize the right to access to information, but also the need to ensure the quality and reliability. These are fundamental rights which the profession must maintain and even fight for. In this context, one must inevitably ask what role librarians should play. Thanks to their training, librarians know how to seek, select, process, and disseminate the information that is best suited in any scenario. However, they clearly cannot act in isolation or individually. We therefore believe that it's necessary to generate a debate on the question with the participation of all stakeholders, be it politicians, authorities, health workers, librarians, and general public, in order to achieve the effective application of this right. So what I did? I believe that as LIS professionals, each of us has an opportunity to help through immediate practical actions and through advocacy. So I have tried to help in both ways. With respect to immediate practical action, I have helped in raising awareness and developed a COVID-19 Information Resource Center that can be used by anyone. With respect to advocacy, I have joined HIFA and I'm now the Lebanon country representative. I look forward to being actively engaged in bringing together all stakeholders to accelerate progress towards universal access to healthcare information. So back in February 2020, and when the first case of COVID-19 was reported in Lebanon, I felt I can make use of my position and expertise to spread awareness among people. So I attended a training course entitled COVID-19 Awareness Training of Trainers. I was also part of the LAMSIC COVID-19 online awareness campaign, whose purpose is to ensure an online presence and platform to cater for the community's concerns and questions via social media channels and using specific hashtags. Moreover, back in March 2020, and with that tsunami of information and the many articles that were shared with the start of the pandemic, I started personally feeling confused of which information to trust, what precautions to apply, what advice to give to others. So using my medical background and having a PhD in biology and my research and searching skills, I decided to start compiling all reliable information in one place, so every one of us would know how to protect themselves from this virus. So I started working on my free, user-friendly COVID-19 Resource Center, which aims to provide up-to-date information on COVID-19 only from credible sources for several interest groups. The link of the guide will be shared in the chat if you want to check and find all the details. Please feel free to go through, to use, and to share, because it targets every one of you, whether you are a healthcare worker or from the general public. After 1 year and a half, this guide is still updated daily with new sections on vaccines, economy, and others, as you can see on the screen. Unfortunately, we don't have enough time to go through all the sections, so please feel free to do so. In addition to the above, I decided to open the library as early as 1st of June 2020, till now, despite all what's happening in Lebanon, in addition to the pandemic. This was not only to provide a learning space for users, but also a social space for them to share ideas, access information, and organize events that target the community in these hard times. I'm also proud to become the Lebanon representative for HIFA and spreading awareness about it in all my courses and events. So now, how can we reshape the future by helping hands together? It's nobody's interest to hide information from you or anybody else, because we are all in this together and we need to be safe to save the planet. As a researcher, I believe that we should let the specialists vet the primary literature and give non-specialists the core. And now, as the head of the medical library, I believe that the library should archive all this reliable information about such a pandemic, should help physicians and researchers access the most recent updates for diagnostic and treatment purposes, and also to spread awareness for the public. Why? Misinformation and fake news are as bad as ignorance. Together, we can save the elderly, the immunocompromised, the children, our families, and can actually save the world. So honestly, I tried to work on spreading awareness rather than the virus. We need to increase our focus on infodemic and false information, both in peace and in crisis. We need to address the causes of the infodemic and misinformation in peace so that we don't face it in a crisis. We need to increase awareness about the difference between misinformation, which is false information but not intended to mislead, and disinformation, which is intended to mislead. Both are false, but they differ in intent. So when there's no known cure for a disease or an illness, information acts as the most successful medicine or vaccine or prescription. So while scientists are working in the laboratories on medical vaccines, librarians and information specialists should work in their libraries on social vaccines. However, this is not easy. As the scientists own the skills to do an experiment to come up with the cure or the vaccine, libraries should invest in empowering librarians with the skills to spread reliable information and to combat false news in the community. Libraries should also contribute in shaping policies along with other stakeholders. They are an important pillar in the framework. Access to information should be part of any strategic development plan at the national, regional, and international levels. We need to work on collective learning and engagement. We are the solution, both at the individual and collective levels. That's why media and information literacy is a cornerstone to developing and implementing access to information policies. We need to get the message and information to everyone, regardless of gender, ethnicity, disabilities, language, religion, anything. In the end, I believe we cannot celebrate September 28 as an International Day for Universal Access to Information, even if only one person is left behind. Thank you so much for listening.
Thank you very much, Ola, for your presentation. Our final presenter is Blessing Mawia. Blessing is from South Africa, and Blessing is going to consider the new and emerging skills in the global library context. Thank you, Blessing.
Thank you very much, Anne, and hello to everyone. My name is Blessing Mawire, and I'm an information and knowledge management specialist based here in Pretoria in South Africa. I have many years of experience working in most of sub-Saharan Africa, and I do value the global partnerships and skills that enable my profession to add value to the African continent. My colleagues today have talked extensively about the importance of promoting universal access to reliable healthcare information and empowering people to tell the difference between reliable information and misinformation. While this is true, the key for library information professionals to achieve this is to ensure that they themselves continue to evolve and adapt in their skills and competences. The importance of new and emerging skills in a global library context is needed for the profession to add value to the infodemic. The World Economic Forum tracks the future of jobs and shows specific skills that will be required in the next 5, 10, and more years. In light of the past and current pandemic, there is likely to be more pandemics in such a future, and the library profession needs to be skilled to combat misinformation in healthcare and meet the information needs of our societies. The Future of Jobs report from 2020 states that the window of opportunity to reskill and upskill workers has become shorter in the newly constrained labor market. This applies to workers who are likely to stay in their roles, as well as those who risk losing their roles due to the rising recession-related unemployment and can no longer expect to return at work. And this does include information professionals. For those workers set to remain in their roles, the share of core skills that will change in the next 5 years is at 40%. And 50% of all employees will need reskilling. And that's an increase of 4%, I unquote. This window of opportunity for reskilling and upskilling is crucial for the information professionals if we are truly to make a difference at a global scale in advancing our roles in providing access to reliable health information and combating misinformation. Adapting and evolving our skills does not only mean working with technologies, it also means rethinking and evolving our traditional skills. A number of questions come to mind. How do we package such skills as systematic reviews so that they're easy to disseminate and use for frontline workers who really have the time to sit and read extensively? How do we package information to marginalized groups who have no access to technologies or who are illiterate? How do we package information to those who have strong beliefs, which are at times contradictory to the evidence that we see? And how do we add our roles to policies and add ourselves to decision-making platforms and initiatives to show the importance of our profession? Today, I'm going to talk about a number of skill sets that are emerging and that we should take into consideration even as a profession, and see how they'll help us to achieve such combating of the health misinformation. We should remember that we are living in an accelerated digital transformation environments, and it is a more norm, and this will continue to balloon in the future. Here I've listed a few examples of some of the emerging skills that are also affecting our profession. How are we as library information specialists incorporating and making use of artificial intelligence, robotics, blockchain technologies, and even data science? Are we making use of these to ensure that we incorporate and embed them in the work that we do on a day-to-day basis and make sure that we do tackle the challenges at hand? I've also categorized our skill sets into people and technical skills. Here we look at people in the sense of two broad arms. One being our users or our clients, and two, our decision makers. For both groups, emotional intelligence is an emerging skill that will really help us in our work, in our role in combating misinformation. Emotional intelligence for both our patrons or our users, as well as the decision makers. With our users, yes, we do have literacy and digital literacy skills and training that we're doing currently and we've been doing in the past, but we need to advance these. How are we advancing them in reality to ensure that our communities are protected from misinformation, and that especially for those communities that have access to technologies? In terms of our decision makers, we need to embrace our technical skills, especially around advocacy. How are we incorporating skills such as writing policy briefs and also adding our voice to the policy-making process? Are we also encouraging our colleagues to have technical writing skills? The third set of skills that we're seeing emerging and that is applicable to our profession is that of the process skills. Collaboration and partnerships is one of the key skills, and especially at a global level, the key skills that we're seeing that is emerging and that is needed in our profession. This is quite essential because if you look even at the Sustainable Development Goals, this is one of the goals that we need to aim at. Collaboration and partnerships means that we cannot work in silos. Gone are the days when we think this is just about my library or my community or my institution or my country or my continent. It is at a global scale that we need to really move and show our role and skill sets and our position as information professionals if we are truly to combat health misinformation. Do we have innovative skills that apply specifically to our own roles and institutions? Skills such as knowledge brokering. Are we embedded in our organizations and institutions, or are we an added on value service? We need to be part of the agenda from an institutional level, at a national level, and at a global level. How do we work with other professionals? Are we making sure that we work with other teams? our data scientists, our programmers, or better yet, are we ourselves making use of these skills and making sure that these team members in these other professions are part of our teams? This is a call to action for IFLA through its SIGs, through its committees, our individual members, and the institutions to equip the current and future library, information and knowledge management professionals with adequate, adaptive, and forward-looking skills required for our future, especially those that will help in reducing health misinformation. What skills do we require in the future to combat misinformation? How are we advancing our skills as a library, information, knowledge management profession to meet the fast-paced advancement our societies are exposed to? These are things and skill sets that we need to constantly think about and how we are evolving as a profession. Where will we be in the next 10 years, in the next 20 years? And how will it truly show the value that we have to add in the march and in the process of combating misinformation? Thank you very much.
That brings us to the end of our session. Thank you very much, Blessing, for your presentation. Thank all the speakers for what you've provided today, for your thoughtful observations based on what are clearly deeply held beliefs. I hope you will all join us for the question and answer session, which follows this presentation, and you'll find a link in the chat. And there we'd like to invite you to ask questions, but also to suggest some solutions for some of the things that we've been talking about today. What is the role of the state? Should we be pressurizing governments to do more? Do we need to get out into our communities more? Do we need to work better across the sectors? Is it not just about asking for a seat at the table, but actually being the people who bring people together around that table? So again, just a final thank you to the speakers for all of their efforts, and also to all the members from me. A big thank you to all the members of the Evidence for Global and Disaster Health Special Interest Group who have worked tirelessly over the last few years to bring these issues to the fore and to work across all of our communities to provide some action for the future. Thank you very much for joining the session, and I do hope you'll join us again soon. Thank you.